registered nurse, aesthetic nurse for Dr. Maurice Sherman here at Mar Cosmetic Medical Center in San Diego, California. Today I'm going to be doing the BBL, which is broadband light by Cyton, on our patient Judy, and showing you the results and walking you through the procedure so you can get an idea of what this procedure entails. I'm going to be doing a test spot on Judy's left side of her face because that is actually where she gets the most sun damage from driving. Most patients have their left side of their face is a lot worse than the right side of their face. And the reason why we do this test spot is to make sure we're at the correct temperature and joules for the patient so we don't have any complications. Our goal here at Mar Cosmetic Medical Center is to be safe and effective. So I feel like this is a great setting to start with, and I'm going to go over your left cheek, okay? Her red spots are redder, her brown spots have gotten a tad darker. All of her dark, her little freckles that she had right here from sun damage and on her jawline are turning darker. Over the next 24 to 48 hours, they will begin to get darker and darker and eventually slough off within the next 5 days. So if you have bad sun damage, there can be a couple of days of downtime, meaning I would like to do it on a Friday and have the weekend for someone to be able to recuperate and stay out of the sun. But there's essentially no downtime. In our 30s, our collagen production starts to slow down, and in our 40s, it actually stops producing. We actually stop producing collagen. So anytime we do a laser procedure, work with our estheticians, and use the proper products afterwards, you are revitalizing your collagen. And that's what makes us look youthful and have the light in our skin that we had when we were in our 20s. It's 20 minutes later and we've finished Judy's face, neck, and chest with the BBL, and now we are going to work on her hands. She's been knowing this whole time, so this is very painless and takes about 10 minutes. So you will see that the brown spots right here on her hands will get darker, and over the next 24 to 48 hours they will continue to get darker and then slough off. It'll give her a more youthful appearance to her hands and just a brighter overall look to her hands. We would do the BBL to take off the browns, and then we would fill the hands with radiesse so that you cannot see the bones or veins in the hands. That gives the hands a more youthful appearance, turns the clock back about 20 years. I now will go back over the hands with the booster, which is a very small tip that can actually get right on the browns, and I can up the fluence on the machine without causing any blistering or pain to her hands. And she'll get that same coffee ground look on her hands like she does on her face, neck, and chest, and they just end up falling off in about 10 days. And after all the browns are gone, we would then maybe fill her hands with 2 syringes of redness. So how was today's treatment, Judy?
Well, it was very exciting to know that it was so convenient to come here to Mar Cosmetic Medical Center in San Diego and have this treatment done, knowing that I'm getting improvement already. I've seen it in 3 weeks, and I'm looking forward to my next treatment.
And we're just here for a post-op procedure checkup to see how the last few days have been, and you look amazing. And I wanted to get your feedback on how things went.
It went very well. I did have a lot of discoloration and melasma, dark discoloration on the face and neck, which is mostly sloughed off. The face is totally clear. I still have a little discoloration here, a little wrinkling here, but that was only my first procedure. And with the next procedure, we hope to see this decrease somewhat. And I went about my business playing tennis and golf, loaded up on my sunscreen. We have a lot of sunscreen here with tints that look like makeup, keeps you totally covered, and no problem with any pain.
I can see that there's still a little bit of discoloration and brown on your chest. That is completely normal. The chest takes a little bit longer to heal, about 14 days, and you're at day 9, so I would expect in about 5 days for that to completely clear up. Keep your tinted moisturizer sunscreen on, the one that I had recommended, and we can schedule your next treatment in about 3 weeks. face, neck, and chest, and each time you'll just notice more brightening, better color, texture and tone, fine lines and wrinkles diminished, and the chest area will tighten, and the little lines that you were complaining of will diminish as well.
Looking forward to it.